The cerebellum controls balance and coordination of movements. The brainstem is the passageway between the cerebral hemispheres and the spinal cord. It controls vital functions such as breathing, heartbeat, but also the movements of the head and neck, eyes, tongue. The brain and spinal cord together make up the central nervous system. The spinal cord is in the continuity of the brain via the brainstem, is directly connected to the muscles by nerves. It allows the transmission of information from the brain to the muscles and organs as motor information, but also from the whole body as organs, muscles, and skin to the brain is the sensory information. The central nervous system is therefore the conductor of our movements, our perception and analysis of the environment, our thinking, our reasoning and our memory. The most common way to observe the brain and spinal cord non-invasively today is through magnetic resonance imaging, MRI. This technology allows us to see the brain and spinal cord in 2 or 3 dimensions. It is based on the reaction of hydrogen atoms present in the tissues to an intense magnetic field, like an ultra-powerful magnet. This reaction makes it possible to map the regions of the brain or spinal cord according to their density and their water content. MRI can play an important role in the diagnosis and evaluation of mental illness by allowing detailed visualization of brain structures and observation of changes in brain activity. However, it is important to note that MRI must be used in combination with other assessment tools, such as clinical examination and psychological testing, to provide a comprehensive and accurate assessment of mental illness. There is also functional MRI, fMRI, which detects the activity of different brain regions during the execution of a simple task, such as moving a finger, or a more complex one such as reading. The more red a brain region appears, the more activated it is. fMRI can be used to diagnose and assess several mental illnesses, including schizophrenia, depression, bipolar disorder, obsessive-compulsive disorder, anxiety disorders, autism spectrum disorders and other neuropsychiatric disorders. The technique allows for the visualization of changes in brain activity associated with these disorders, which can help to better understand the causes of the illness. fMRI can also help assess the effectiveness of treatments for mental illness. For example, it can visualize changes in brain activity after psychotherapy or after taking medication, which can help healthcare professionals adjust treatment to improve outcomes. fMRI can play an important role in the diagnosis and evaluation of mental illness by allowing visualization of brain activity in real time and a better understanding of the mechanisms underlying mental disorders. However, it is important to note that fMRI must be used in combination with other assessment tools, such as clinical examination and psychological testing, to provide a comprehensive and accurate assessment of mental illness.